Growing concerns over the Zika virus, the dangerous disease transmitted by mosquitoes, is spreading across the United States at, quote, explosive rates. Here to break down the details, Dr. Manny Alvarez, FoxNewsHealth.com senior managing editor. We were driving in the car this morning to school. We heard on the radio, pregnant women, you may want to skip that warm weather vacation. You heard the quote into the last commercial break where they said an explosive rate. How frightened should people be?
Look, I think we have to be a little concerned. Number one, I'm critical of the CDC. Just today, a couple of letters went out by some of the Congress leadership telling the CDC, hey, what's going on? Again, 4,000 cases in Brazil over 2014, 2015, perhaps many more because they just started counting, and 4,000 cases of children born with microcephaly. Okay, this is a very lethal type of condition. These are newborns that are born with small brains, small heads. So these children are going to have a lot of difficulty. When you look at the transmission rate of Zika that is happening in the different countries, about 22, 23 now, all through South America, all through Central America, the Caribbean, many cases, including here in New York already, we have reported. This is going to be a problem. You know, the mosquito, this mosquito that is infesting all of these countries needs to be eradicated, and that's the first thing the CDC has to concentrate, to do.
So what would you tell people who may become pregnant? Because one of the things is that it's really dangerous in the very beginning when you may not even know you're pregnant.
Listen, a lot of scientists already are saying we don't know the correlation.
No, I'm kidding. I'm just coughing. I know. Keep going, please.
Look, we know that for sure that if you're pregnant and you happen to be pregnant early in the game, probably, and you get infected with this virus, you're going to have a congenital malformation. Maybe if the baby's more advanced, maybe not. But this is a true fact already scientifically that has been shown. So if you're pregnant and you're thinking of going to any of these Latin American countries, South America, this is not a good idea for sure.
So what does the Center for Disease Control do from here? I mean, do we eradicate this? Why is this happening now?
A couple of things. They have to bring support to some of the, public health departments in those countries, so you could have the eradication of the virus. Second, they're working on a vaccine, but, personally, we see these things. The vaccine is going to take a year. They have to be tested. So we're not going to have a vaccine to market just yet. So it's all about prevention, eradicating the mosquito, and monitoring the pockets of outbreaks that are happening.
Can it happen somewhere that's not in one of these countries that they're showing? I mean, now there are people around the office, all of a sudden we have mosquito bites. Do you think you shouldn't have it in the middle of winter? Listen, everyone's in a panic.
This virus has been around for a long time. This is not a virus that got off the bus the other day. This, yellow fever, West Nile virus, dengue, and Zika, they all belong in the same family. It is the mosquito, the transmitter of this disease, that is now growing so much because we have stopped fumigating for many, many years. And this is the same mosquito that was around when we were building the Panama Canal and had the yellow fever and killed thousands of people. So it's all about that. But in this particular case, Zika virus in pregnancy is the problem. And also, we have seen pockets of a disease called Guillain-Barré, which is a neurological deficit, and we're seeing pockets of that through South America.
I'm going to cover myself with a mosquito net and stay inside. Dr. Manny, thank you so much.